Good morning, everyone. Welcome back. Thank you for joining us. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, the Science and Technology channel.
Yep, and we got a story for you today. This is going to make a lot of people probably very happy.
Yeah, let's find out how to do this.
Yeah.
An endocrinologist's new weight care system halted population level weight gain and could reshape obesity treatment across America. For years, endocrinologist Leigh Perreault, medical doctor, believed there had to be a more effective way to help people manage their weight than simply advising them to eat healthier and exercise more. You hear that all the time. There was a moment I put my face in my hands and thought, what am I doing? I would write a lot of prescriptions for patients, diabetes, their blood pressure, their lipids, and these other conditions, says Perot, a professor of endocrinology, metabolism, and diabetes at the University of Colorado Anschutz School of Medicine, who practices in Westminster alongside primary care physicians. Would you like to know more?
Okay, quote, none of these people want to be on these medications. And I thought if I could just help them with their weight, many of these health concerns would probably go away. And I'm going to assume that that's probably from Dr. Perot, right?
Yeah.
She continues, that realization led to the creation of a new system that is rapidly gaining attention in the field of obesity treatment. Okay.
Perot and her colleagues developed Pathway. Pathweigh. Pathway. Remember that, Pathway. A structured process that helps primary care teams and patients make weight management a priority through dedicated clinic visits, focused specifically on weight-related care. With support from the National Institutes of Health, the program was introduced in 56 UC Health primary care clinics across Colorado to evaluate its impact. The effort ultimately reached 274,000 patients, making it one of the largest randomized trials ever conducted.
I was going to say, that's a lot of people.
Yeah.
Research published in Nature Medicine found that Pathway reduced population weight gain by 0.58 kilograms over 18 months and shifted the overall trend from weight gain to weight loss, an important outcome from a public health perspective. The program also increased the chances that patients would receive weight-related care by 23%.
Okay. The VA has something called MOVE, where this is focused on nutrition and weight management. All right, quote, with Pathway, we showed that we absolutely eliminated population weight gain across all of our primary care, which has never been done previously, Perot says. As a result, obesity specialists are increasingly viewing Pathway, Pathweigh, as a model for standard care, and several health systems around the country are exploring adoption of the program.
You know, I got to ask you a question about this person's name. Maybe we'll get through this first. Now I got to ask it. Why we pronounce that Perot? I get that if it just ended in the U, but there's an LT at the end. Why do they have that LT on there? Is that a French thing?
Frenchy. Yeah, Frenchy.
Gotcha. Okay. According to Perot, one of Pathway's biggest strengths is that it helps patients and primary care providers work toward the same goal. Quote, if you think about weight loss medicine or surgery or a weight loss program, those are all vehicles to weight loss. That's according to Perot. Going on with the quote, we built a highway that we could put all the vehicles on, so there's actually a process for people who receive weight-related care if they wanted it.
Yeah.
I don't think they know.
The process begins with signs placed on clinics informing patients that they can schedule a visit specifically focused on weight management simply by requesting one at the front desk.
Once a patient makes that request, a feature within the electronic health record automatically sends a survey. After the survey is completed, the information is incorporated directly into the provider's notes. This allows appointments to focus less on collecting background information and more on discussing potential solutions.
Quote, it made the whole process really efficient and then effectively turned our note template into a menu of anything that we might do, Perot says, continuing her quote. It really made it extremely time efficient and consolidated everything we might do for a patient into one interface.
Data gathered during the 18-month study showed that roughly 1 in 4 eligible patients received some form of weight-related care at least once. Most often, that included guidance on lifestyle changes, but prescriptions for anti-obesity medications doubled during the intervention.
Unlike many traditional weight loss programs, Pathway allows treatment plans to be tailored to each patient's needs. It also reduces much of the discomfort that can make conversations about weight difficult for both patients and clinicians. Quote, most people who want or need weight-related care never get it. Either they don't ask for it or the providers don't bring it up. And if they do, the patient usually gets told to go home and eat less and exercise more. And then nothing happens, Perreault says.
Well, which is probably a pretty good thing. I mean, if you eat less and you exercise more, chances are you lose weight. But I know people that do not. They'll exercise and they'll eat less and they still do not lose weight.
It depends on what you eat and how your metabolism is. People have slow metabolisms. Some people have high metabolisms. It really matters.
Yeah. Okay. Another quote. The person gets frustrated and then they learn to not ask for help anymore because it's kind of embarrassing and it doesn't help. I get that. This was a safe space to say, hey, if you would like medical assistance with your weight, we actually have a process for you to receive that now. So,
researchers note that rising obesity rates have been linked to an average population weight increase of about 0.5 kilogram per year. Preventing that gain and turning it into weight loss, like they said, 0.58 kilograms in 18 months loss, could play a significant role in slowing the obesity epidemic. Quote, while it's not a significant difference on an individual patient level, it's a huge deal on a population and public health level, Perreault says.
The researchers also found that patients who received measurable weight-related care through Pathway experienced greater weight loss. Even among those who did not receive identifiable weight-related treatment, the program helped reduce the amount of weight gain that would normally be expected. Okay.
Additionally, quote, when patients did receive discernible weight-related care, Pathway was associated with greater weight loss and also mitigated the expected weight gain for those who did not receive discernible weight-related care, researchers concluded.
Perreault says the program's success has opened the door for broader adoption. Efforts are now underway to bring Pathway to health systems outside Colorado. Okay. The Obesity Association, which is currently developing its first standards of care for obesity treatment, is highlighting Pathway as a recommended care process. Okay.
5 health systems spanning 7 states are also considering the program as its creators work toward licensing the model. Quote, I'm really proud that Pathway was homegrown and built and tested here in Colorado, Perreault says. This is the blueprint that moves us forward. Love it. Let's go.
Yeah, and the only thing that I could see the negative effect on that is the millions and millions and millions of dollars that are involved in weight loss programs that may go by the way of the dodo, right?
Yeah.
This guy comes through and it sounds pretty promising. It's going to put a lot of people out of business, and then what are they going to do? Send me your money. So
give me your money.
Give me your money. Yeah.
All right, folks.
All right.
Thanks for joining us.
Take care, everyone. We'll see you on the next one. Thanks.